Hello, I am Dr.Suraj, hematologist and BMT physician working in Mumbai. Today we will discuss second most common cause of anemia, that is megaloblastic anemia. Megaloblastic anemia broadly signifies the presence of large size red blood cells and reduced number of blood cells in the CBC test. So, what are the causes for megaloblastic anemia? Megaloblastic anemia is mostly caused by deficiency of two vitamins, vitamin B12, cyanocobalamin, and vitamin B9, folic acid. Vitamin B12 deficiency mostly happens because of the malabsorption, decrease in dietary intake, or there are some intestinal diseases that retards the absorption of vitamin B12, giving rise to megaloblastic anemia. While for vitamin B9, folic acid deficiency mostly causes dietary deficiency followed by malabsorption. Sometimes alcohol consumption in increased quantity can lead to folic acid deficiency, or there are some medicines which blocks the metabolism of the folic acid that leads to megaloblastic anemia. Coming to the symptoms of megaloblastic anemia, mostly symptoms are related to anemia, just like weakness, fatigue, breathlessness. These are the most common symptoms. Sometimes because these people had ineffective erythropoiesis, this can lead to jaundice as well. So coming to next, what are the blood tests? Blood tests mostly it can be detected easily on CBC because MCV in these disorders is more than 110. So that is almost 90% sensitive to point towards the megaloblastic anemia. But there are some disorders like myelodysplastic syndrome, aplastic anemia, autoimmune hemolytic anemia, where MCV lies between 100 to 110. So sometimes there is a diagnostic dilemma. There we need to do other organ function evaluation like liver function test, because we know the jaundice can happen in these disorders, kidney function test, and sometimes Coombs test to distinguish between autoimmune hemolytic anemia. In rare circumstances, like when there is a possibility of aplastic anemia and myelodysplastic syndrome, then we need to confirm or differentiate from the vitamin deficiency. We need to do it bone marrow test. Sometimes we need to do it when after treatment they don't respond to the their hemoglobin doesn't respond to the vitamin supplementation, then we also need to do a bone marrow test. Coming to the treatment is simple. We need to give the appropriate vitamin what is reduced, like vitamin B12 if reduced, or vitamin B9 is reduced as we detect on the blood test, then we need to treat accordingly. There are oral as well as IV supplements also available. There can be dietary changes. Vitamin B12 is most rich in dairy products, meat, eggs, so we need to increase their intake, while vitamin B9 is mostly present in green leafy vegetables and other red meat, poultry and eggs also, so we need to increase their diet suitably. Then we need to do some lifestyle changes, like if we are taking if the patient is taking excessive alcohol, we need to stop it. Or sometimes just like underlying diseases, like any patient underwent a major abdominal surgery, then we need to put them on empirical vitamin B12 and B9 supplements. Thank you for watching this video. Please see the description box for the details and contact us for the further information. Thank you.